Hello everyone, welcome back to my YouTube channel, The Disease Decoder. Today our topic of discussion is pneumonia. As we will start with the question, what is pneumonia? Pneumonia is an inflammatory lung condition that primarily affects the alveoli. What are alveoli? The small air sacs where oxygen exchange occurs. These are the small oxygen air sacs in the lungs where oxygen occurs. When these sacs become filled with pus or fluid due to infection, it leads to symptoms like cough, fever, chills, and difficulty in breathing. Pneumonia can range from mild to life-threatening, especially in vulnerable populations like the elderly, young children, or those with weakened immune systems. This is the definition of pneumonia. It is an inflammatory lung condition that mainly affects our alveoli, and the alveoli becomes filled with fluid or pus that results in fever, cough, chills, and difficulty in breathing. Now let's talk about the types of pneumonia. There are five common types of pneumonia: community acquired pneumonia, hospital acquired pneumonia, ventilator acquired pneumonia, aspiration pneumonia, and atypical pneumonia. What is community acquired pneumonia? CAP. This type of pneumonia is contracted outside of healthcare setting. It is the most common form and can be caused by various bacteria, viruses, or fungi. Streptococcus pneumonia is a frequent culprit. Streptococcus, Streptococcus pneumonia. Who is at risk of community acquired pneumonia? The elderly, smokers, and people with chronic illness are more susceptible to community acquired pneumonia. Our second type is hospital acquired pneumonia. Hospital acquired pneumonia occurs during a hospital stay, particularly in patients already weakened by other conditions. It often more severe than community acquired pneumonia due to presence of antibiotic resistant bacteria. Antibiotic resistant bacteria. It is more severe than commonly acquired pneumonia due to presence of antibiotic resistance bacteria. Um, the persons who are hospitalized, particularly those with intensive cares, uh, are usually the patients of hospital acquired pneumonia. Our third type is ventilator acquired pneumonia. This is a subtype of hospital acquired pneumonia that develops in people who are on mechanical ventilation. Mechanical ventilation. Patients on long-term ventilation, especially in intensive care units. Patients who are intensive care unit are usually the patients can be the patients of ventilator acquired pneumonia. Our fourth type is aspiration pneumonia. Aspiration pneumonia occurs when fluid, liquids, or vomits are inhaled into the lungs, causing an infection. Okay, this type often involves an aerobic pneumonia. Individuals with swallowing difficulties, such as those with neurological disorders, can be the patients of aspiration pneumonia. I hope you understood. Our last type is atypical pneumonia, also known as walking pneumonia. Walking pneumonia. This form is usually milder and caused by organisms like Mycoplasma pneumonia. Mycoplasma pneumonia. Symptoms might be less severe, but it can still cause significant discomfort. Young, uh, mostly present in young adults and school going children. Okay, these are the five types of pneumonia: community acquired pneumonia, hospital acquired pneumonia, ventilator acquired pneumonia, aspiration pneumonia, and atypical pneumonia. Now, let's talk about the risk factors of pneumonia. Pneumonia doesn't affect everyone equally. Several factors can increase your risk of developing the diseases. Age is the first risk factor. Infants, young children, and older adults are at higher risk of pneumonia. Chronic diseases like COPD, asthma, heart diseases, and diabetes make you more vulnerable. Our third risk factor is smoking. Smoking damages lung tissues, making it easier for infections to take hold. Our fourth risk factor is weakened immune system due to HIV, AIDS, cancer treatment, organ transplantation, or long-term steroid use. Our fifth risk factor is hospitalization, particularly if you are in an intensive care unit or using a ventilator. As we discussed earlier, in hospital acquired pneumonia or ventilator acquired pneumonia, our last risk factor is environmental factors. Living in crowded conditions, exposure to pollutants, or working in healthcare can increase your risk to have pneumonia. Now, our next section is pathophysiology. Pathophysiology of pneumonia. Let's pause. This is the alveoli. My drawing is not so good as I usually say, so ignore it. The journey of pneumonia in the body begins when an infectious agent enters the alveoli. This triggers the body immune response, leading to inflammation. Alveolar walls swells, and the alveoli filled with fluid. Okay, alveoli becomes filled with fluid, pus, and immune cells. This impairs the exchange of oxygen and carbon dioxide, leading to symptoms like difficulty breathing or reduced oxygen levels in the blood. The extent of lung involvement and the strength of the immune responses dedicate the severity of the disease. I hope you understood. First, the foreign particles enters the alveoli, and then it causes the swelling of the alveolar walls and the filling of the alveoli with pus and fluids. This causes a difficulty in exchange of oxygen and carbon dioxide, as the alveoli, the main function of the alveoli is to exchange oxygen and carbon dioxide with the blood. This is the pathophysiology of in pneumonia patients. Now let's talk about the sign and symptoms of pneumonia. Our first symptom is cough. Often the first sign, it may be dry or produce mucus that's green, yellow, or even tinged with blood. Yellow, green, or tinged with blood. Our next sign and symptom is fever and chills. Commonly, as the body tries to fight the infection, that results in fever and chills. Our next is shortness of breath. Breathing becomes difficult due to fluid in the lungs, as we discussed in the pathophysiology. Fluid accumulates in the alveoli. Next is chest pain, often sharp or worse when breathing difficulty or coughing. Next is fatigue. The body uses a lot of energy fighting the infection, leading to exhaustion. Next is confusion, especially in older adults. Especially in older adults, pneumonia can cause mental confusion. Our second last sign and symptom is tachypnea, rapid breathing as the body tries to increase oxygen intake. Our last sign and symptom is cyanosis, the bluish tinge to the skin, particularly around the lips or fingertips, due to lack of oxygen. These are the main signs and symptoms in the pneumonia patients. Our next topic of discussion is diagnosis. How we diagnose the pneumonia patient. Accurate diagnosis is crucial to managing pneumonia effectively. Our first tactic should be physical examination. A doctor listens to your lungs with a stethoscope, checking for abnormal sounds like crackles or wheezing. Next is chest x-ray. The imaging test shows areas of opacity in the lungs which indicates infection or fluid buildup. X-rays shows infection and fluid buildup. Next is blood tests. Blood tests can reveal evaluated white blood cell counts indicating infection and measure oxygen levels in the blood. Next is sputum culture. Analyzing a sample of mucus from your lungs can help identify the specific bacteria or virus causing the infection. Pulse oximetry, a non-invasive test that measures the oxygen level in your blood. Next is CT scan, a more detailed imaging test. X-ray is also the imaging test. CT scan is a more detailed imaging test, usually when the X-ray results are unclear or if there are complications. Our last tactic for the diagnosis should be bronchoscopy, a procedure to look directly at the airways and obtain samples, usually in severe or unresponsive cases. These are the techniques for the diagnosis of pneumonia. Our last section in the treatment of pneumonia is medications. We use different type of medications for different types of pneumonia, like antibiotic treatment for bacterial pneumonia, treatment for viral pneumonia, and treatment for fungal pneumonia. These are the main drugs. Um I don't go into long details of how they work. The first drug is beta lactams, often used for mild, moderate, community acquired pneumonia. Community acquired pneumonia. It's effective against Streptococcus pneumonia. Streptococcus pneumonia. Our next is macrolides. It is also effective against mycoplasma pneumonia. Our third disease is fluoroquinolones, used in cases of severe pneumonia or when the patient has combined conditions, effective against a wide range of bacteria. Our fourth medication should be tetracyclines, effective against atypical pathogens like mycoplasma. It's a common choice for mild to moderate cases of community acquired pneumonia. Okay. Our fifth medication should be carbapenems, used for severe hospital acquired pneumonia and ventilator acquired pneumonia. Our sixth medication in antibiotic treatment for bacterial pneumonia is aminoglycosides. They are typically used in combination with other antibiotics for severe hospital acquired pneumonia and ventilation acquired pneumonia. Our second treatment strategy should be treatment for viral pneumonia. We use antivirals for viral acquired pneumonia. These are the main antivirals. Uh, you can search it on Google or in medical books. Effective. This antiviral is effective against influenza-related pneumonia, influenza-related pneumonia, remdesivir for treating COVID-19 pneumonia, and acyclovir used in cases of pneumonia caused by herpes simplex virus or Vorticella zoster virus. Okay, these are the medications used for the treatment of viral pneumonia. Now talk about the treatment for fungal pneumonia. We use antifungals for treating fungal pneumonia. These are the main antifungals used for fungal pneumonia caused by Candida species. Candida, fluconazole and voriconazole is used for severe fungal infections. Severe fungal infections. Now let's talk about the sportive treatments along with medications. First is oxygen therapy, administered to maintain adequate oxygen levels, especially in severe cases where blood oxygen levels are low. Corticosteroids, sometimes used to reduce inflammation, particularly in severe cases. However, their use is controversial and should be closely monitored. Third is bronchodilators like albuterol. Bronchodilators. How bronchodilators work? They help to relieve bronchospasm and improve breathing in patients with concurrent obstructive lung diseases. Our last sportive treatment should be fluids and electrolytes. Intravenous fluids may be necessary to prevent dehydration and support the body immune system. This is all about the pneumonia. We started with the definition of pneumonia. Pneumonia is an inflammatory lung condition that affects our alveoli, and the alveoli becomes filled with pus fluid that results in cough, fever, chills, and difficulty in breathing. And then we talked about the types of pneumonia. There are five types of pneumonia: community acquired pneumonia, hospital acquired pneumonia, ventilation acquired pneumonia, aspiration pneumonia, and atypical pneumonia. We discussed them in detail. Then we talked about the risk factors. First risk factor is age, chronic diseases like COPD, asthma, heart diseases, and diabetes. Next risk factor is smoking, weakened immune system, hospitalization, and environmental factor. Then we talked about the pathophysiology like infectious agent enters the alveoli and it results in thickening and alveolar walls and the alveoli to be filled up with fluid or pus that results in difficulty in exchange of oxygen and carbon dioxide that results in difficulty in breathing. Then I talked about the sign and symptoms like main sign and symptoms are cough, fever and chills, shortness of breath, chest pain, fatigue, confusion, tachypnea and cyanosis means blue skin. Then the ways of diagnosis. First way of diagnosis is physical examination. Examine the patient carefully. Then chest x-rays, blood tests, sputum culture for identifying the bacteria, pulse oximetry for identifying oxygen concentration, CT scan, and bronchoscopy. Then I talked about the treatment strategies. There are three treatment strategies: antibiotic treatment for bacterial pneumonia, antifungal treatment for fungal pneumonia, and antiviral treatment for viral pneumonia. In antibiotic treatment for bacterial pneumonia, I discussed six medications used commonly in healthcare system. Then I discussed treatment for viral pneumonia and I discussed antivirals. We use three antivirals and I discussed their functions too. Next is treatment for fungal infections. Antifungals are used for fungal infections. two I mentioned two fungal antifungals and their effects. The last but not the least is supportive treatment. We support the patient along with medications with oxygen therapy, corticosteroid, bronchodilators, and fluids and electrolytes. This is all about the pneumonia. I hope you enjoyed the video. If you have any concerns, let me know in the comment section. And if you like the video, share with your friends for the enhancement of their clinical skills too. Thank you.